The Trump administration has dismissed over a dozen Justice Department lawyers involved in investigating and prosecuting former President Donald Trump in two high-profile criminal cases. The firings, effective immediately, targeted members of former special counsel Jack Smith's team, which had brought charges against Trump for alleged mishandling of classified documents and attempts to overturn the 2020 election results. Acting Attorney General James McHenry stated the lawyers could not be trusted to faithfully implement the president's agenda due to their roles in the investigations. Many of the dismissed lawyers were career prosecutors with expertise in corruption and national security, serving across multiple administrations. The firings followed Trump's re-election and his administration's decision to close the cases, citing Justice Department regulations that bar the prosecution of a sitting president. The move has drawn sharp criticism from legal experts and former officials. Joyce Vance, a former U.S. attorney, called the firings anti-rule of law and anti-democracy. The Justice Department also saw significant shakeups, with several senior officials reassigned or resigning, including the chief of the Public Integrity Section. Trump and his allies have long accused the Justice Department of political bias. Pam Bondi, Trump's nominee for Attorney General, echoed these accusations, describing the department as weaponized against Trump and Republicans. Jack Smith, appointed as special counsel in 2022, oversaw investigations into Trump's handling of classified documents and alleged efforts to overturn the 2020 election. Both cases resulted in criminal charges, to which Trump pleaded not guilty. Smith defended his work, dismissing claims that his decisions were politically motivated, calling such accusations laughable. The cases were ultimately closed after Trump's election victory, leaving unresolved questions about accountability. Coinciding with the firings, acting U.S. Attorney Edward Martin announced an internal review into charging decisions related to Capitol riot cases. Prosecutors were ordered to provide documentation on decisions to bring obstruction charges against over 200 defendants. The dismissals and broader reshuffling of Justice Department personnel underscore the contentious relationship between Trump and the federal legal system. Critics argue these actions undermine the rule of law, while Trump supporters view them as necessary to reform what they see as a politically biased institution. The U.S. Centers for Disease Control and Prevention, often referred to as the CDC, has ordered an immediate halt to all collaboration with the World Health Organization, or WHO. In a memo issued Sunday night, CDC official John Nkengasong instructed senior leaders to cease all engagement with the WHO. This includes technical working groups, advisory boards, cooperative agreements, and both in-person and virtual interactions. Additionally, CDC staff were directed to refrain from visiting WHO offices. This abrupt decision follows President Donald Trump's executive order to initiate the U.S.'s withdrawal from the WHO. This process requires congressional approval, the fulfillment of financial obligations, and a one-year notice. The president's administration has also restricted federal health agencies from communicating publicly through at least the end of the month. The sudden cessation has alarmed public health experts who warn of serious setbacks in combating global health threats such as the Marburg virus, Mpox, and avian flu. Dr. Jeffrey Klausner, a public health expert at the University of Southern California, called the decision a big problem and noted the disruption in the flow of critical information between the two agencies. Talking to WHO is a two-way street, Klausner said, emphasizing the collaboration's importance in sharing expertise on tests, treatments, and emerging outbreaks. This is vital for protecting Americans both abroad and at home. The broader implications for global health programs are profound. The halt in collaboration could undermine ongoing efforts to control infectious diseases and hamper the response to future health crises. Many fear that without the coordinated efforts of the CDC and WHO, the world may be less prepared to tackle emerging health threats. The CDC has been a key partner with the WHO, detailing nearly 30 staff members to the organization and providing millions of dollars in funding. The agency's daily communications have been instrumental in addressing infectious diseases and public health emergencies worldwide. The freeze on WHO collaboration is not the only global health initiative affected. The Trump administration also halted funding for the President's Emergency Plan for AIDS Relief, a program credited with saving 25 million lives since its inception under President George W. Bush. PEPFAR currently provides HIV treatment to over 20 million people worldwide. Beatrice Grinstein, president of the International AIDS Society, warned that halting PEPFAR funding would interrupt treatment, causing a resurgence of HIV and potentially leading to widespread fatalities. Public health experts have expressed dismay over the sudden stoppage. Klausner noted that many anticipated a gradual withdrawal, making the abrupt directive all the more disruptive. This decision leaves global health efforts vulnerable, he said. The collaboration between CDC and WHO has been vital in addressing health crises and safeguarding public health globally. A U.S. health official, speaking anonymously, confirmed the memo and the halt in collaboration, further highlighting the uncertainty surrounding the decision and its long-term implications for global health initiatives. The Biden administration has released a 16-page roadmap detailing efforts to strengthen U.S. defenses against infectious diseases, just as President-elect Donald Trump signals plans to dismantle some of those measures. The report outlines steps taken during Biden's tenure to address threats like COVID-19, Mpox, and bird flu, while also providing a 300-page pandemic prevention playbook to the incoming administration. The Biden administration emphasized its efforts to combat infectious diseases, highlighting initiatives such as nationwide vaccination campaigns and early detection systems using wastewater to identify outbreaks. Dr. Paul Friedrichs, director of the White House Office of Pandemic Preparedness and Response Policy, said Biden's leadership turned the tide of the COVID-19 crisis, describing the administration's actions as laying the foundation for faster and more effective responses to save lives now and in the future. The Pandemic Office also reported strides in combating avian flu, including stockpiling 10 million vaccine doses effective against the strain circulating in the U.S., and investing $176 million to develop mRNA vaccines that could be quickly adapted to new mutations. Late-stage trials for these vaccines are expected to begin soon. President-elect Trump has pledged significant changes to the nation's pandemic preparedness infrastructure. He previously criticized the White House Pandemic Preparedness Office as a very expensive solution to something that won't work, and has indicated plans to cut government spending and disband the office. Trump's first administration faced criticism for dismantling a National Security Council pandemic unit in 2018, which some experts argue contributed to a disjointed response to COVID-19 in 2020. Trump's team also attempted to withdraw the U.S. from the World Health Organization, a decision reversed by Biden but likely to be revisited under the new administration. Experts warn that leaving the WHO could undermine the U.S.'s ability to track emerging health threats globally. This would hurt our ability to gain critical information about outbreaks before they reach U.S. shores, said Dr. Ian Lipkin, an infectious diseases researcher at Columbia University. While Trump has been praised for the success of Operation Warp Speed, which accelerated the development of COVID-19 vaccines, public health experts express concern over his broader pandemic policies. Jennifer Nuzzo, director of the Pandemic Center at Brown University, criticized the insufficient response to avian flu under both administrations, calling for more aggressive measures to prevent a potential pandemic. "We've been underreacting to what many see as a serious threat," she said. Michael Osterholm, an infectious disease expert at the University of Minnesota, emphasized the importance of maintaining robust vaccine development and global surveillance efforts. "We don't know what virus will cause the next pandemic," he said, urging sustained investment in detection and preparedness. The abrupt shifts in pandemic policy come amid ongoing global threats, including a bird flu outbreak affecting U.S. livestock and sporadic human infections. The Biden administration has prioritized collaborations with international partners to monitor and contain emerging diseases, but it remains unclear whether Trump's administration will maintain these efforts. "We need to keep training investigators abroad and investing in surveillance where risks are highest," Lipkin said, expressing hope that Trump's team will recognize the importance of proactive measures. As the transition looms, public health experts remain divided on the future of U.S. pandemic preparedness, with concerns over potential disruptions to ongoing initiatives and the nation's ability to respond to future health crises.